So hello, everyone. My name is Kate. I'm a medical student here at McMaster. The study that I am going to review today is a systematic review looking at the quality of economic evaluations in hand and wrist surgery. This is a project that I did with Dr. Toma. And just a quick note before we begin that we have no conflicts of interest to declare from any of the authors. So, why do we care? Why even look at economic evaluations to begin with? Well, our Canadian healthcare system is under a lot of pressure. We can see that right now with the COVID-19 pandemic, but this was happening long-standing before COVID-19 even began. And the reason for that is if we look at it, here, I just put together a quick little graph to show this visually, but if we look at the orange line there, that describes the economic growth that our country has had over the past 20 years. And on average, year over year, it's about 2.7%. And then if we compare that to the blue line represents our average healthcare spending increase year over year, which is at 5.5%. So what we're seeing is that there's going to be an increasing gap in a difference between our healthcare spending compared to how much our economy is growing, which is problematic because that money has to come from somewhere. So it's either going to come through increasing taxes or it's going to come from borrowing money that's through other publicly funded programs such as education and taking money from that pool and putting it into healthcare. Or the third option and the most favorable option is to look at how we can create efficiencies in our healthcare system. And so that's what economic evaluations do. They look at comparing different interventions within specific conditions and describes the most cost-effective option. So in hand surgery, here were a few of the intervention options for different conditions that we came across, just as some examples. And before we go into the study itself, I just wanted to provide a quick overview of different types of economic evaluation. So there's sort of two different categories of economic evaluations, one of which is partial, and these are also known as cost analyses. And what partial economic evaluations do is they look at costs of different interventions at a specific point in time. So really they're only looking at direct costs, for instance, at the time of surgery itself. So things like the cost of the materials and supplies associated with the surgery. But what you can appreciate is that that doesn't really give the full picture. It's just giving the sort of the hard costs at the time of surgery. Whereas full economic evaluations, and here were two of the types of full economic evaluations that we came across in our study, although there's also cost benefit analyses, which we won't go into today. But full economic evaluations give a more well-rounded picture. So not only does it look at the direct cost at the time of surgery, but it looks at cost through time. So it takes into account things like complications and the probability of those complications from occurring, and it incorporates those costs as well and projects that through a model over time. And I won't get into too much of the nuances of the different types of economic evaluations today, but as you go through the different types, the quality increases. So cost utility analyses look at specifically cost per quality adjusted life year, which is really the best practice. So the objective of our study was to look at the economic evaluations published in hand and wrist surgery and look at specifically the methodological and the reporting quality of economic evaluations. And before we begin, I just wanted to highlight the differences between methodological quality and reporting quality. Methodological quality being in the quality of the methodology of the study and how it's conducted, and reporting quality being the quality of the study and the article itself on what's actually published. So what were our methods? Well, we did a literature search, and our study periods were between 2006 to 2020 for methodological quality and 2014 to 2020 for reporting quality. And those weren't arbitrarily selected. It was because what we were doing is we were looking at the economic evaluations and we were appraising them with different checklists. So the methodological quality checklists were last published in 2005, so we gave about a year grace period. And the reporting quality checklist was published in 2013. And so again, we gave that year grace period for people to review them. And so the checklist that we used to appraise the studies we used Drummond's checklist for methodological quality, as well as the QHES checklist and CHEC. And we looked at the Cheers checklist to appraise the reporting quality. The reason we selected 3 methodological quality checklists was because none of them have been validated. And so we used 3 to really make sure that we were getting a full picture of the methodological quality. So in terms of moving to our results of the study, so our literature search resulted in just over 4,400 studies, and we included 47 articles. And of those articles, you can sort of see here in the top right corner that 72% of the economic evaluations that were included were partial economic evaluations, and the remainder were full economic evaluations. And so what we did is we looked at only the reporting and the methodological quality of the full economic evaluation because the checklists were designed to appraise full economic evaluations as opposed to partial ones. So as you can see here, the quality was quite strong of the full economic evaluations, which could be expected. But we did find some themes. So we found that the checklist items were quite consistent across the different checklists. And the ones that were least satisfied were often least satisfied in all of the different checklists. So some of those ones that were least satisfied were the use of an appropriate discount rate as one, the use of an appropriate time horizon as another, and then the lack of an inclusion of a description of the quantities of the resources that were used. And then the graphs here, they're just describing that the methodological and reporting quality has remained fairly consistent over time. So it hasn't really improved significantly since the checklists were first published. And then here, what we wanted to look at as well is, should we be using all three methodological quality checklists, or can people who are looking to appraise the quality of economic evaluations, specifically the methodology involved, can they sort of choose one instead of using all three? And so we looked at the association and the variance. And what we found here is that CHEC could be used because it does have the strongest association and the highest amount of variance can be explained through that. We also wanted to compare the quality of economic evaluations in hand surgery and look at that and compare it to other specialties. So we looked at some systematic reviews that were published in other specialties as well. But what we found is that often, most often actually, the other studies were looking at partial economic evaluations and including those in their appraisal, which wasn't appropriate. So we weren't really comparing apples to apples here. So I think the key takeaway was more just looking at the percentage of economic evaluations that were partial versus full. And what you can see is that in hand surgery, it's quite significant, the amount of percentage of economic evaluations that are partial as opposed to full. And in comparison to the other studies that we reviewed in other specialties, we were actually the third highest in terms of the percentage of partial economic evaluations, behind only plastic surgery and vascular surgery. And then I wanted to highlight why this was important. So I took an example of a partial economic evaluation that was included in our study, and I also took an example of a full economic evaluation. And I wanted to highlight some of the key differences here of why the quality of the full economic evaluation is higher and why it's more useful to clinical decision makers when they're deciding between interventions. So first, I just wanted to highlight the study perspective. So in the partial economic evaluation, what we found broadly is that a lot of partial economic evaluations did not include the study perspective. Whereas the perspective is so important because it's important for the reader to understand when they're describing costs, who those costs are accounted for. So in the example here, it's a societal perspective, which often includes the government perspective and the taxpayer perspective, the cost to the society as a whole. The time horizon is also really important. So I touched on that a little earlier, where partial economic evaluations are often an instantaneous point in time, whereas here you can see in this example by Sears and al., they actually projected costs over 50 years. And why that's important is because often you want to take into account the rest of the patient's lifetime. So any sort of chance that they can experience complications in the rest of their life, you want to be able to capture that. So 50 years in this case was very appropriate. And if you're doing that, if you're projecting costs through a model over 50 years, you really want to take into account the value of time and money principle. So that's something in the business world where you really sort of, it's the concept that the value of money today is higher than the value of money will be tomorrow or in future years. And so in this case, you can see Sears and al. Discounted future costs in years after this year. They discounted annually by 3%, which is very appropriate. And so they did that quite well. And then effectiveness, it's important not only to look at direct costs as a whole, you also want to take into account the clinical effectiveness of these interventions. And so here, Sears and all looked at not only what complications occur, the probabilities of those happening, but they also accounted for when they actually occur in terms of a timeline. So do these complications happen in a few months from now, or do they happen in a few years from now? And they took that into account. And then valuing health state, you can see not done in the partial economic evaluation, but it's really important to include this because it's necessary in the metrics when you're calculating quality adjusted life years. So this is basically the value of different health states. So a year in pain, for instance, would be less valuable than a year where you're feeling energized and quite well. And so this was elicited through a survey and the full economic evaluation from both the public, but also medical professionals as well. Then some of these checklist items get a bit nuanced, but of course it's important to include the model we've discussed already. In terms of incremental costs and outcomes, this is basically summarizing it in a measure of having your costs per unit of effect. So again, in this case, this was a cost utility analysis. So it was cost per quality adjusted life year. And that's really important because in healthcare, it's not just the bottom line, but you also want to make sure that these interventions are clinically effective as well. So overall, the full economic evaluation, as you can see through the sort of the picture that I've painted here, is much more effective and useful to clinical decision makers than a partial economic evaluation would be. And in fact, if you relied on that partial economic evaluation, you might actually not get the right conclusion. You might choose something that just the materials cost less and that's it, but it might not be clinically as effective, and they might have more complications down the road. So that's really important for everyone to take into account. So some key conclusions from our studies is that overall economic evaluations are very important, especially with the state of our healthcare system today, that full economic evaluations are more informative. And then looking at our study in hand surgery, we found that partial economic evaluations were quite prevalent, but of the full economic evaluations that were published, the quality was quite strong. That concludes my presentation. Thank you very much. I'm happy to answer any questions.